Hi, this is Dr. A, and here's your clinical chemistry review video on glucose testing, A1C, and oral glucose tolerance test. All right, let's start with the measurement of glucose. So glucose can be measured in whole blood, serum, plasma, urine, and body fluids like spinal fluid and other body fluids. Whole blood is usually 10 to 12% less than serum because of the presence of the cells and all of that. Usually you want to separate the cells from the serum into plasma within an hour to prevent the loss of glucose, because glycolysis or the metabolism of glucose by the red cells can lower glucose by 5 to 7% per hour. Your fasting blood glucose should be obtained in the morning after an 8 to 10 hour fast. And the sodium fluoride tube will inhibit glycolysis, so that is your gray top tube. So if the accuracy is important and the testing is going to be delayed, you really want to use this gray top. You can use a green top or a red top, so the lithium heparin for the green top, or just the serum tube also to test for glucose, but of course then you want to pull the serum or plasma off the cells or test it really quickly. There are a few methodologies used to test for glucose. The hexokinase method is the gold standard in glucose testing. It is the reference method and has higher specificity. It is a coupled enzyme assay. It uses a hexokinase enzyme, and basically glucose and ATP will react with hexokinase to produce glucose 6-phosphate and ADP. Glucose 6-phosphate reacts then with G6PD dehydrogenase enzyme, and it will make 6-phosphogluconate. And using this reaction, the glucose 6-phosphate always uses NADP or NAD and converts it to NADPH or NADH, and this production of NADPH or NADH is what is measured, and it will be proportional to the glucose concentration, and it causes a color change. With the glucose oxidase method, it is another coupled enzyme assay. It uses a glucose oxidase enzyme. It is cheaper to do, so a lot of labs will use this one. With the hexokinase is more expensive. However, high levels of bilirubin, uric acid, and ascorbic acid, which is vitamin C, can cause decreased readings. In this method, glucose reacts with water and oxygen with glucose oxidase and makes gluconic acid and hydrogen peroxide. And then the hydrogen peroxide is used with peroxidase in a color reaction. This goes from colorless to colored with water, and then the color change is proportional to the concentration of glucose. So let's talk a little bit about the oral glucose tolerance test. It has to be performed correctly. So for one, the patient needs to come in fasting, and you need to get some fasting levels of glucose, and then you give them a loading dose of 100 grams of glucose, usually in like a really sweet drink. And after that, samples are collected for glucose, usually at 30 minutes, 1 hour, 2 hours, and 3 hours. This test is no longer recommended by the ADA for diagnosis of diabetes, but it's commonly used to screen for gestational diabetes. Most oral glucose tolerance tests are 3 hours in length, but there's also a 2-hour postprandial, so in which the patient will drink a 75-gram glucose load and then just check the glucose 2 hours later. So either way, when you're looking at the results, this is a curve. So the normal curve is what you really want to see. So you get the fasting should be normal, and then they get their glucose load. Their glucose is supposed to climb and then go back down. Sorry about that. I clicked on it. Go back down to normal pretty quickly within 2 hours here. But if they're diabetic, for one, their fasting glucose could start already elevated, and they will go high above 200 and stay at 2 hours. They'll still be above 200. At 3 hours, they'll still be around there. So it takes a long time for it to go back down. And then for that 2-hour postprandial, you don't do the fasting, but basically you load them up in that 2-hour window. If they're above 200, then they would be considered diabetic. Okay, now going on to glycosylated hemoglobin. So this test is used to monitor long-term glucose blood glucose regulation. And so that it gives a more accurate picture of what your patient's actually been doing over the last few months. So it is averages a 2 to 4 month glucose measure. This is related to the lifespan of the red cells. Glycosylated hemoglobin is a formation of a hemoglobin compound produced when the glucose reacts with the amino group of hemoglobin. So basically, sugar sticks to a lot of stuff and it likes to stick to protein. And so if the blood sugar is high, a lot of sugar will stick to the hemoglobin. And the thing with this reaction is, one, it does not require an enzyme. Two, once that sugar is stuck on hemoglobin or other proteins, it can actually stick on albumin also. It does not unstick. It stays on there, okay, until the red cell is destroyed. And so the hemoglobin A1C is the most commonly detected glycosylated hemoglobin, and the gold standard method for measurement is high performance liquid chromatography. There are also immunoassay and colorimetric assays that are available for glucose A1C testing. And patients who have a condition that affects red cell survival should not be monitored this way, obviously, because you won't get that 2 to 4 month glucose measure because the red cells aren't living that long. This kind of illustrates a low or normal A1C. You might have a little bit of sugar stick to the hemoglobin, but not a lot. But with high sugar levels, there's a lot of sugar that glucose that will stick to the hemoglobin, and so it doesn't lie. It will tell you what your patient's been doing kind of more habitually, if you will. There's the fructosamine test, not used widely, but it gives you kind of a 3 to 6 week glucose measure, and it's subject to interference by low protein levels, hemolysis, lipemia, icteria, uricemia, and heparin. Sometimes fructosamines can be used for people that are diabetic and also have a condition that affects the survival of hemoglobin. The ketones are produced by the liver through the metabolism of fatty acids. They provide an energy source from stored lipids for the cells to use alternate usually to glucose. Obviously, ketones would be increased with carbohydrate deprivation or decreased carbohydrate use. So in diabetes, type 1 diabetes, for sure, starvation, fasting, and high-fat diets, so like the keto diets, and part of the keto diets the point is to increase the ketones. There are 3 types of ketone bodies. There's acetone, that's only 2% of the ketones. Acetic acid is 20%. And 3-beta-hydroxybutyric acid is 70%, or the majority of the ketones, and that's usually the one that is measured by most testing methods. The specimen does require fresh serum or urine. So there you go. So ketones, you would see those for type 1 diabetes, but if they're present and they're not diabetic, then you need to look at if they're doing a keto diet or if they're either fasting or starving. And that is the lesson. Thank you.